The Tobacco Addiction Group is one of more than 50 Cochrane groups which devote themselves to looking at the evidence base for different areas of healthcare, and the Cochrane Collaboration is a global initiative to find the best evidence about healthcare interventions. We don't do any primary research. That's to say that we're not running trials, we're not doing surveys, we're not interviewing people. What we're doing is the next level up. We're finding other people's research, in particular randomised trials, and we're bringing their data together. We start by defining the question. So, does a particular treatment help a certain type of person, and what's the outcome going to be? And then we try to find every study that's addressed that question, and then we synthesise that evidence using pre-specified methods. So all the time we're trying to avoid the bias that sometimes creeps in. So what we do takes place largely in the background, doesn't have a very high public profile, but it is incredibly important to be able to identify these treatments, so we really can help smokers to give up, change tobacco use in this country and globally, and do that by using the most rigorous bias-free methods. So even though I came from a scientific and medical background, and I knew that smoking was bad for you, when I first started and looked at the research, a lot of it done by Sir Richard Dole here in Oxford, and realised that of people who smoke throughout their lives, half will die from smoking, which is just extraordinary. And people say, oh, I smoke, but I could fall under a bus. Well, actually, it's the smoking that's likely to kill them, not they're so unlikely to fall under a bus. So I do get frustrated when smokers tell me that, oh, it doesn't really matter and they don't want to be old anyway, because they die young of old people's diseases. I find my job fascinating, and I love the fact that in some small way our work can help people. Of all the health problems that are addressed in the department, I think smoking is the most important one. It is the single most important change that people can make to their behaviour. If you smoke, you really need to give up, and we really need to be able to help you.